In this video, we'll discuss about coronary artery disease, also called as CAD. So what is coronary artery disease? It is a condition that affect heart. So coronary artery disease, it is a condition that affects heart. CAD happen when coronary artery struggle to supply the heart with enough blood, oxygen and nutrient. This one will happen when coronary arteries struggle to supply to heart with enough blood, oxygen and nutrient. In this condition, cholesterol deposit or blacks are almost always to blame. So in this condition, cholesterol or blacks are deposited in that arteries. So here cholesterol or blacks deposited. This build up narrow arteries, decreasing blood flow to heart. So this one here build up of cholesterol, so it will decreasing blood flow to that heart. This can cause chest pain, shortness of breath or even a heart attack. So here a cholesterol will deposit, so less amount of blood supply only. So it causes chest pain, shortness of breath or even heart attack. It begins when fat, cholesterol or other substances gather along the wall of arteries. This process is called as atherosclerosis. It begins when fat, cholesterol and other substances gathered along the wall of arteries. This process is called as atherosclerosis. CAD typically takes a long time to develop. So often patient don't know that they have it until there is a problem, but there is a way to prevent CAD and ways to know if you are at risk and a way to treat it. Who get it? Anyone can develop CAD. So CAD take long time to develop, so many patient doesn't know when they have medical emergency. Anyone can develop CAD. It is typically no cause for concern. However, too much buildup can lead to blockage, obstructing blood flow. Too much buildup can lead to blockage, obstructing blood flow. There are number of risk factors common. Red flags can contribute to this and ultimately leads to coronary artery disease. First, getting older. Older can means more damaged and narrowed arteries. Old age, more damaged and narrowed arteries. Then second factor, gender. Men are generally at a greater risk and comparing to women. Risk for women increased after menopause period. Third one is existing health condition. Existing health condition. Then high blood pressure. This one can thicken arteries. Then high cholesterol, increasing the rate of plaque buildup. High cholesterol, increasing rate of plaque buildup. Then diabetes, then being overweight. So age, gender, then existing health condition, high blood pressure, the high cholesterol, diabetes and being overweight also associated with higher risk of coronary artery disease. Then lifestyle play a large role as well. Lifestyle including physical activity, long period of unrelieved stress in life, long period of unrelieved stress in life, then unhealthy diet, smoking, and finally family history also. So these are the things can causes increasing risk. If close relatives was diagnosed at an early age, close relative have coronary artery disease means with a heart disease, so you are a great risk. All these factors together can paint a picture of your risk for developing coronary artery disease. So these are the factors will causes coronary artery diseases. Age, gender, health, education, high blood pressure, high cholesterol, diabetes, being overweight, lifestyle and family history. Next, what are the symptoms? The coronary artery become narrow. The heart does not get enough oxygen rich blood. Heart does not get enough oxygen rich blood. Remember, unlike most pumps, the heart has to pump its own energy supply. Heart has to pump its own energy supply. It is working harder with less, and you may begin to notice these signs and symptoms of pressure or tightness your chest. Pressure or tightness in your chest. This pain is called as angina. It may feel like somebody is standing on your chest. So, the sign and symptoms of pressure or tightness to your chest. This condition name is called as angina. In this condition, we feel somebody is standing on our chest. When your heart cannot pump enough blood to meet your body needs, you might develop shortness of breath. So, whenever heart cannot pump enough blood, you meet your body needs, you might develop shortness of breath. Then extreme fatigue during activities. Whenever we will do any activities, that time we feel fatigue, tiredness. If an artery become totally blacked, it leads to heart attack. The classical sign and symptoms of heart attack: crushing, then chest pain, then pain in shoulder or arms, then shortness of breath and sweating. Crushing, chest pain, pain in shoulder and arms, shortness of breath and sweating. However, many heart attacks have minimal or no symptoms and are found later during routine testing. Many heart attacks have minimal or no symptoms are found later during routine testing. How is it diagnosed? Depending on that, suggest one or more the following test. Main things need medical history, then physical exam, then routine blood work. Then we can using for identification of coronary artery disease, we can use ECG, echocardiogram, then sound wave test for the heart, then stress test, then cardiac catheterization, then angiogram, cardiac CT scan. So by using these are the tests we can diagnose mainly medical history, then physical examination, then routine blood test, then electrocardiogram, echocardiogram, sound wave test of the heart, stress test, cardiac catheterization, angiogram, cardiac CT scan. Then how to treat? Treating coronary artery disease, usually making changes to our lifestyle. So here treating, we can change our lifestyle. This might be eating healthier food, then exercise, regular exercise, then losing excess weight, reducing stress, and quitting smoking. What are the way we can treat? Eating healthier food, regular exercise, loss excess weight, reducing stress, and quitting smoking. Then the good news is these changes can do a lot to improve your outlook. Living a healthier life, okay, living a healthier life translate to having healthier arteries. When necessary, treatment would involve drugs like aspirin, then cholesterol modified medication, beta blockers, a sudden medical procedure like angioplasty or coronary artery bypass surgery. We can use to treat coronary artery disease. We want to take drugs, aspirin, cholesterol modifying medication like beta blocker, then sudden medical procedure like angioplasty and coronary artery bypass surgery. So these are the way we will treat CAD.